Today's meeting is going to be a Medicare 101. We're going to talk about special election periods a little bit, and low income subsidy. So the next training that I do will be more on, we'll go more over the sales process as far as this Medicare 101, as far as the clarity guide and how to sell. Okay, here's someone, Tim's coming on here. So this is the clarity guide, and this is United Healthcare's. We kind of always train to use theirs because they're free. You can order as many of these as you want, just from United Healthcare's toolkit. And this is like the first thing that when you open up their clarity guide, it has this sheet in there. And we always tell clients to read the clarity guide, front to back. It's about 8 to 10 pages, but it has good information about the Medicare Advantage plans and how they work. It talks about like prescription drug coverage and the donut hole and all that in the clarity guide. And if you haven't read through the clarity guide, we always want agents to do that, because not only do you learn, but especially as new agents, especially for new starters and all that, it's good to read through that because you learn a lot. And then just reading that, you'll know more than the people that you're sitting in front of. All right. So when I sit down in front of somebody, every agent's different as far as the rapport building. Some agents I've seen have their family pictures and these binders, to talk about themselves. But after you do build rapport, because every agent's different, the first question I ask is, what was your situation again? And because when you're talking over the phone, you find out, but then it could be a week or two later your appointment is. So you always want to just ask real quick, hey, what was your situation again? And they go, oh, well, I'm turning 65. I'm losing my employer plan because I'm 75 years old, and I've had an employer plan, but now I'm stopped working. I'm going to stop working, and I'm going to lose the employer plan. So I need to grab Medicare and a plan. So something like that, or it could be even a more weird situation. And that's why you look to the election period booklet sometimes to find out what election period you can use. Most election periods are straightforward, like the annual election period, which was October 15th to December 7th, where you can make any change you want for a January 1st effective. But also the open enrollment period is what we're in now. So right now is the open enrollment period, and it's from January 1st to the end of March. And that's where folks have one chance to change their Advantage plan to another Advantage plan, or they can change their Advantage plan to a supplement and a prescription Part D plan. They can't go from a supplement plan to an Advantage plan during that time. So the government gives them that 3-month period at the beginning of the year to change their Advantage plan, just in case their doctor's not in the network, because remember, the Advantage plans are more network based, HMOs or PPOs, which HMO is Health Maintenance Organization and PPO is Preferred Provider Organization plan. So remember, an HMO, they have to go in network and usually have to get a referral from their primary to see a specialist. Whereas a PPO, a Preferred Provider Organization plan, they can go in or out of network. They can go to any doctor that takes Medicare nationwide without a referral. They just pay a little bit higher copay if they go out of network. So I just added Tammy on. Okay. So I added just someone else that just came on. But so let me get rid of that. And so the big thing is right now you're in the open enrollment period. You can't market the open enrollment period, but you can call people and bring it up in conversation. So let's say you're cold calling people, remember, because you can cold call people about supplement plans because they're considered a financial plan, not a health medical plan. You can cold call people on supplement plans, but then you turn it over into an Advantage plan by just asking them, hey, there are other types of plans out there, Medicare Advantage plans, but if you want to talk about the other option you have, we do need to do a scope of appointment. And it's no matter who talks to you on Medicare, they have to have that scope of appointment signed. All right. But Special election periods. So when you're sitting down with them, remember, and one of the first things I ask them again is that, what is your situation? And that's when they're going to tell you, hey, I'm losing my employer plan, that type of thing. And then that's when you find out what enrollment period you're going to use. And it might be a special election period enrollment. So then I say, well, I want to explain how Medicare works and how the plans work with Medicare. And that's when I go right into this. And I'm showing them this as I'm talking to them, the Clarity Guide and this page from the Clarity Guide that shows the Medicare card at the top. And then there are two options. So, I'm kind of giving you the sales process while we're talking about everything as we go along here. But this sheet right here, this one page sells the plan. You already get the buying signs right away while you're talking about it. So right at the top, you say, hey, here's your Medicare A and B, your original Medicare, and it has a picture of the red, white, and blue card. Part A, you can see right there on that line right under where it says Part A, that is their inpatient hospital benefit. And Part B is everything that's outpatient. So that's the easy way to look at that. And they're going to pay zero premium for Part A for working 40 quarters of their life, basically 10 years. And also their spouse would also get Part A at zero premium if the other spouse didn't work the 40 quarters. So if one of the spouses didn't work it, they can use the other spouse's benefit to get Part A at zero premium. If they don't work the 40 quarters, they're going to pay almost $500 a month now for Part A. It's like $460 or $470, something like that for Part A a month. And if they just have Part A and no plan, they're going to pay that deductible. And I think it's around $1,484 a month. I think it may have just went up, but it's around $1,484 from days 1 through 60. So the first day in the hospital, they're going to have to pay that deductible. And then the next, the 60 days are covered 100% after that deductible. But then after 60 days in the hospital, from day 61 to 90, they're going to have to start paying, I think it's around $368 a day now. And then days 91 to 150, they're going to have to pay double that. So around, $782 or whatever it is a day. And then after that, after 150 days, they pay 100% of the bill. So that could get ugly real quick if they go over 60 days in the hospital. So that's why you want, you say, hey, that's why you want a plan that I help you with that helps you with those costs. Now, Part B is everything that's outpatient. So office visits like primary care, specialist, chiropractor, physical therapy, outpatient surgeries, CAT scans, MRIs, lab work, emergency ambulance, durable medical equipment like wheelchairs, oxygen, all that falls under Part B. And folks have to pay $170.10 a month now, unless they make more than $88,000 a year as a single or $176,000 a year as a couple. If they make more than that, then they'll have to pay more for Part B, and it's on a scale up to around $500 a month. So some folks that make a lot of income have to pay up to $500 a month for Part B. And also Part D now. So they added a couple of years ago where they'll have to pay more for Part D with that same income scale up. So just let them know that if they make more income, they might pay more for Part B. So you want to definitely go over that with them. Also, the other end of the spectrum is if they make less than 17, it's around 1710 now. I sent out to everyone that was invited to this meeting, I sent out the low income subsidy levels, the new chart I just got for 2022, and it's around 1710, I believe, or less a month to qualify for extra help with the Part B premium and the cost of prescriptions. So if you make low income, you can get extra help with Part B and the cost of prescriptions. Someone else is coming on. Let me see here. Someone else is coming in. Yeah. Someone else is coming in the meeting. Hold on. So if someone makes low income, they get help with their Part B premium possibly and the cost of prescriptions. So there's 4 levels of extra help with prescriptions too. But the average person nationwide, if they qualify for any extra help with the government, with the Part B and the cost of prescriptions, the average person saves around $3,900 a year nationwide if they qualify for extra help, right? So those are the two ends of the spectrum on Part B and D. So most folks making just Social Security or on Social Security usually just pay the $170.10 a month. Can that person mute? Is that you, Tom?
It is me, Todd. I've been trying for 20 minutes to get in.
Okay. Can you mute? All right.
Yeah, I'll mute.
Okay. Sounds good. All right.
I think I can.
All right. So those are the two ends of the spectrum. So when you start talking about Part B, you give them those levels of extra help, or they might have to pay more for Part B. Also, if they sell a house, you want to let them know that could jump them up for a year because their income jumps up for that year, for the following year, because it's always last year's tax return that they pay for the next year. So let them know if they sell a house, it could jump their Part B up, because I've had clients where they've sold like 2-3 houses and jumps them up to where they, have to pay that $500 a month. Always talk about that, because situations come up like that. Also, on the Part B, the reason why people have to pay the $170.10 a month for Part B or more is that after a $203 deductible once a year, the government's going to pay 80% of all those bills. They're left with 20%. The problem is they pay 20% on all those bills, and there's no cap with Medicare. So they pay 20% of all those outpatient bills all year round, and there's no cap. So we basically say that you're bleeding if something major happens, like cancer with radiation, because that's considered outpatient. So radiation therapy for cancer, they pay 20% of every radiation therapy, and it wouldn't stop. That's why you want a plan that helps you with those costs. And you're already getting buying signs from people. Like almost everyone says, oh man, yeah, shoot, that's crazy. Or yeah, I need a plan. Or, they understand right when you talk about that, because a lot of times people think that they can just have the red, white, and blue card and don't need nothing else. Well, you just explained to them that no, it can get ugly real quick if you don't have a plan to help you with a cost that Medicare doesn't cover. So you're already getting buying signs. So now you say that below, you can see option 1 and option 2. You say, well, when you get on Medicare, there's only 2 options of plans. So all this stuff you're getting in the mail, your mailbox is falling over with all the mailers from companies, agents, you're getting marketing, all the calls they're getting, especially now more than ever. The calls are coming fast and furious, especially during the annual election period. And the commercials on TV. So like Joe Namath and all that. And when they're talking about on these commercials about the give back and the get extra help, you can get your Part B paid for. They make it sound like everyone can get their Part B paid for, the $170.10 a month. But obviously they have to qualify by being low income. But they make it sound like everybody can get it. So it is getting people to call in. They're good hooks. Also, the give back program is where some companies have it to where they might be able to get some of their Part B back just built into the plan, into the Advantage plan. So like up here in Washington, for example, some of the plans give $50-$60 back on their Part B. And it's up to 50 or 60, because if they're already getting extra help with their Part B, they're not going to get a check back. So you'll get that question too. Well, if I'm already getting my Part B paid for and the plan says they're going to give $60 back, am I going to get a check? Well, no. If you're already getting your Part B paid for, then you don't get that 50-60 give back, because you're already getting the Part B paid for. That's another big question we get from clients and agents. All right. So when you get on Medicare, there's only 2 options of plans. So that simplifies it for you. And option 1 is a Medicare Supplement plan, called gap insurance. And how those work is that when you go with a Medicare supplement plan, they become secondary payer to Medicare. So Medicare, your red, white, and blue card is going to pay 80% of the bill on outpatient bill. And then your Medicare supplement plan is going to help with the 20%. And anyone turning 65 after January 1st, 2020 can't go with Plan F anymore. They can only go with Plan G. So basically, the government's telling everyone that was 65 after 2020, January 1st, 2020, that they're going to have to pay that $203 deductible once a year. So they have all these A through N plans, and they're standardized nationwide. So a plan A is an A G is a G, and N's an N. But Plan G now is the top plan if you're 65 after 65 after the January 1st, 2020. So Plan G is around, it's different between states and counties and areas. But let's say in the area that I'm on this from, let's say Plan G is $193 a month, give or take, depending on which company. Just giving you average, like $193 a month. Northern California, they only pay around $120 for Plan G. Oregon, about $136 for Plan G, somewhere around there. So you can see that some areas are higher. LA is going to be probably $220, I think it is, somewhere around there for Plan G. So it's a little bit more expensive in different areas, even within a state. So all the supplement plans, different states have different ways to calculate out their premiums. So there's like community-based rating, there's age detained rating. But once you find out the zip code, if they say, yep, I want option one, because sometimes you'll be in an appointment and they already know what they want. And they go, yep, I want option one, like right as you're talking about it. So then you just go right into the application then and say, hey, this plan. Now, another good question to ask now is that what gym do they want to go to? Because remember, all these plans now give them gym membership at no cost. The United Healthcare AARP was the first one to offer gym membership help on the supplement plan. And it was only like a 50% discount. But now all the companies have it where you can get the gym membership at no cost. So you want to find out what gym they want. And then you should know what companies have what gym membership. So like some companies have the Silver Speakers program. United Healthcare has their own. It's called Renew Active. Regents has the Silver and Fit, the Blue Cross Blue Shield plans. And it could be a different gym membership in a different area, a different state. So always look at what gym membership it is, and you can go to that website and look for the locations. And that factors in a lot of times to what plan people go with. So gym membership is one of the first questions you ask people. And then you want to make sure the plan that you get them, either the supplement or the Advantage plan, has the gym at no cost that they want. All right. So if they go with a supplement plan, option one, that only covers medical. They would need to get a standalone Part D plan for prescriptions on top of that. And remember, if they don't take out a Part D prescription plan when they get on Medicare, they're hit with a penalty every month they don't have one. It's 1% of the national average premium of a plan. Every month that they don't take out a plan, it accrues. So what that means is that they're never hit with a penalty if they never take out a Part D plan. But if they do take out a Part D plan later on, they're going to be hit with that penalty. And it keeps getting bigger every month that they don't have Part D. So I do have clients that when the Part D plans came out in 2006, I have clients that never took out a plan and their penalty is around $50 a month just for the penalty on top of the premium of the plan. So some clients may opt to do just the supplement and never take out a Part D plan because they don't want to pay the $50 a month penalty plus the premium of the plan. A lot of those folks just end up using GoodRx for their meds, or which is a free program. It's an app you can download to your phone or computer. You can go to goodrx.com all you have to do is look up a drug and they can get a discount on meds. And that actually is saving people money just by using GoodRx over any Part D plan out there for especially medications that are a little bit more expensive. So GoodRx is a program you always want to talk to about with clients now, every appointment. So bring up GoodRx and say, hey, and have it on your phone and show them the program, because you can save them, $300, $400, $500 a year just on one medication. So you want to always talk about GoodRx as well when you're talking about Part D prescription. So on option 1, you can see that you have your Part B premium of $170.10 a month, and it could be higher than that on income. Plus, you would have your, let's say if they went with Plan G supplement, that'd be another couple $100 on top of that. And then a Part D plan, the average is around $30 a month nationwide for a Part D plan. There are some new companies coming out with lower premium plans for like around $7.70 a month. And those plans are really good because they're lower premium. They do have usually the deductible of around $480, and it's on usually tier 2 through 5. So whereas the other plans that are around $30 a month usually have that $480 deductible, but only on tiers 3 through 5, just brand name drugs. So you're already getting buying signs when you talk about option 1, and 98% of the time it's, oh man, that's expensive, or what's the other option? Like you can tell right away that that premium is too high. They don't want to pay that. Plus they've already heard on TV and on this, all the marketing pieces they get about the zero premium. So you definitely will get the buying signs, and most people are going to be like, well, what's the other option? I've heard about the zero premium, or yeah, what's the other option there? So then you go right into that. Option 2 is the Advantage plans. They're considered Part C of Medicare, and they usually come with Part D built in, for prescriptions. How option 2 works, the Advantage plans, is that when they go with the Advantage plan, option 2, they take over for Medicare while they're on the plan, and they pay the whole bill except for small copays. So for doing that, they get paid every month that they're on the plan. So the Part B premium, the $170.10 a month, that comes right out of your Social Security. That goes into the Medicare pool, and they basically turn around and give that to all the companies that offer option 2, plus a little bit more. And the option 2, the Advantage plan, saved the government about 3% a year, which doesn't sound like much, but we're talking in the hundreds of billions of dollars. Option 2 does save the government about 3% a year, because the government doesn't have to pay their the bills anymore, and they don't have to pay someone to do the billing anymore on an option 2 Advantage plan. So they do get paid, they do make a profit, and most of these option 2 plans are low premium, and a lot of times zero premium. They have zero premium plans, and these plans, they keep adding more and more benefits to them every year. So the next question people usually ask, or you already know what they're thinking, is then, well, what are the copays that I'm going to pay? So that's when you want to go right into the plans. And for that county, you should know what the best plans are. But if you don't, then what you'll want to do is you'll want to go to the Medicare Center that all of you have access to, because you're agents with us. You have access to that Medicare Center, and you can put the zip code in, and then look at all the plans that are available in that county. But you want to also put in their medications, their doctors, especially if you're dealing with a county that you don't know that much about. So let's say you took a lead and it's in Arizona. Well, you may not know, about the plans there. But if you go to Medicare Center, and I'll bring that up now. Let me bring that up. Let me share my screen and bring up Medicare Center. Let me see here. Hopefully you guys can see my screen once I switch over. Hold on here. Let me bring up Medicare Center real quick here. And can you guys see my screen, or do I need to do a share again? Can you guys see the Medicare Center on your screen or no?
We can see it.
Okay. So this is Medicare Center, and you have access to this. If you don't, and you haven't accessed it, you can get a hold of me and I'll walk you through it. So give me a call or email me and walk you through it. But this is the Medicare Center where you can quote and enroll. So we can do a deeper dive on a different training, but I just wanted to go over this real quick. I'll hit quit this quote and enroll. I put the zip code in. So 98, I'll just put the zip code in from an area. So what I want to look at, I can check any of these plans, supplements, Part D, Medicare Advantage with Part D, just Medicare Advantage without Part D, special needs plans. So also, are you taking prescription medications? You say yes, put all their medications in there because you want to make sure the plan covers the medications. I would definitely put the medications in there because it'll do all the work for you, or else you could sit there and, you know, look at each company separate and, you know, check their formularies and all that. But this is nice and fast to look up all that. And this is the same engine that Medicare.gov uses. So it's up to date.
Hey,
So,
Todd.
yep.
So one of the things that, because I've been using Medicare.gov and the prescriptions, I've noticed on some that the inconsistency that they aren't dollar for dollar.
Yeah.
And when I go ahead, when I find a plan, like on Medicare.gov,
Yep.
then I'll go and I'll double check that against, say, United Healthcare.
Yep.
And I have found on more than one occasion that Medicare.gov and UHC are not in sync with their pricing.
Exactly.
And so is Medicare, is this more reliable than Medicare.gov, or is it still the next step is once you kind of zero in on a plan or two is to go back to the carrier and double check the work? Yep.
I would definitely do that. I always check the enrollment guide because, for example, like United Healthcare, since you brought that up, United Healthcare has most of the drugs in their drug list that's right in their enrollment guide. So especially if it's a more expensive drug, I would double check it, because as you're doing this, obviously, you know, a lot of the medications that are like tier 1 and generics, but you know, if you're not real sure, then yeah, I would definitely just double check with the plan. So, but never give them the numbers as far as like, you know, hey, this United Healthcare is going to save you, you know, it shows that your annual costs are going to be $3,000. And WellCare shows 5,000, you know, because those are usually not only wrong, but another agent is going to say, oh, well, actually, it's only going to cost you 1,500, you know, from what I see, and then you'll lose them. So I never recommend doing it that way. I always tell people what the tier pricing is, and then give them what they'll pay for each medication on the tier. So in other words, hey, this one is a tier 1 generic, this one's a tier 2 generic. You'll pay 0 for those through the, you know, United Healthcare's mail order, or you'll pay 0 at the pharmacy, or $12 or less for a month supply of tier 2s, for example. But then if it's tier 3, then you're going to say, hey, you know, it's covered at this, 47 or less for a month supply, you know, after a deductible, if there is one. So you always want to do it that way. Never go off of the, like, hey, it says you're going to pay $3,000 for the year for all your meds, because they could use GoodRx for some medications instead of the plan and save, you know, $500 to $1,000 a year just on that. So it's always it's better to do it that way, because you don't want to lose people, because another agent's going to tell them do exactly what I just did, and then you'll lose them because you're giving them a $3,000 a year to $5,000 a year quote, when in actuality it could only be, you know, $1,000 or $1,500. So definitely double check the you know, against that plan's um, enrollment guide or, formulary. Yep. So, like Aetna, for example, they only have a small little list of drugs in theirs, but I check that first. And then if it's not in that little drug list that's in their enrollment guide, then I, go to aetnamedicare.com, for example, and just check those medications that weren't in that list. But I always just give them the tiers and the how much it'll cost. And then I also, for some drugs, I check GoodRx right with them as well. So, hey, with GoodRx, it's only going to cost you, 12 instead of 30 with the plan.
Yeah. We spend a lot of time on GoodRx because we do counsel our clients on that, and it does help save money.
Yep. No, perfect. So, and since you're giving them that advice, I've noticed, that clients really love you and want to stay with you because you're giving them extra, saving them money and showing them things that they can actually use in the real world, whereas these telesales agents with these companies aren't going that. They're not talking about GoodRx or nothing like that. So, good question. And then, so you're going to put the doctors in, you can put pharmacy in, you can put medications in, and then you hit view all plans. And then what you want to do is make sure to take off this appointed only button. So, because it may only show you a few of the plans you're appointed with, because we are contracted with other uplines with other plans. So you take that off just to, show all the plans that are available in that area. So if you're not comfortable with that area, you definitely look here and you want to look into, maybe a few different plans to see which plan is the best. So, this last AEP, I think it was, where was that? Anyway, somewhere in California, I looked it up. I checked 3 or 4 or 5 different plans for someone and found out that, Aetna was actually by far the top plan, for that person, because it covered their meds and drugs better, and the benefits of the plan were better than the other plans in the area as well. So, let's see. So you can see here all the plans. So what you want to hit is the details, and then you can, on that at the top, plan details. Let's see, where's the prescription here? Usually has the prescription there. Maybe this one doesn't have prescriptions, but anyway, you scroll all the way down and you can download the summary of benefits, the evidence of coverage, star ratings, all that. So you always want to download this summary of benefits right away and save it to your computer. That way you're going to send it to that client and not have to go back and download the summary benefits to send to them. Why not just do it right here real quick? Boom, save it to your computer. And then not only is it for that client possibly, but also from another client down the road. If you have it, get another client in that same area, you already have it downloaded to your computer. So, this plan obviously must not have prescription, but because then it would have a button here that says prescriptions. So, I didn't put any in. That's why maybe that didn't pop up. So, but it is showing what the cost would be for medications. Actually, it scrolled me down to the bottom here. And then if you would put prescriptions in, it would actually tell you what tiers those medications are. All right. So this is how you check real quick on that. The other thing that you want to do, obviously, like Norma was talking about, is just double check everything on that. Double check the gym membership, what gym they want, because that really factors in now to what people do, especially the baby boomers. All turn to 65 right now. A lot of them do use gyms, and it's an important benefit. Obviously, because of COVID, now people are going, well, I did like to go to the gym, or I was going to the gym, but not now. So I am getting a lot of clients, and you will too, that are saying, well, that's not that big of a deal now. So you definitely want to talk to them about that. Well, you say, well, what if it clears back up and you do start going back to the gym, what gym would you like to use? Because some plans cover some gyms and some others cover other ones that, so you always want to check that too. That's one of the first questions we ask now. And so, well, any questions on like the Medicare 101 part of this, because I'm going to go into special election periods next. Anybody have any questions, go ahead and unmute and ask. But that right there is the sales process, because then you're usually, going right into the application. My close, I always do the same close every time. It's a real easy close on someone, is that, hey, if you want this plan, it's going to start February 1st or March 1st. So right now, if I sign them up, it would be March 1st. Say, hey, if you want the plan, it'll start March 1st. And then they'll say, yes, no, maybe, let me think about it. I got to talk to the rest of the family. I had that the other day. A guy was helping his sister, but he needed to talk to other family because she was disabled. So that's one instance where, you may have to wait, but most folks, 99% of the time, say, yep, let's do it. Let's go with it. And that's my close. It's real nice and easy. And never worry about like premium. You don't have to do the zero premium, because people will pay a premium. But up here, for example, they have this plan one that's $88 a month. We did a whole campaign on that, and people actually signed up for the $88 a month plan over the zero premium plan, just because we, talked to them about, well, it's a better plan and $88 a month, so, but the zero premium plans now are getting better and better. And a lot of times you don't even need to go to a plan that has a premium, because these zero premium plans have gotten, especially the last 3 years, have added more and more benefits and getting better and better. So anyway, any questions? If not, I'm going to move to the special election period. I'm going to bring up the special election period booklet. Let's see.
Todd, I have a question.
Go for it.
Where do we find what all the premiums are, though?
That would be right here in that Medicare Center right here. So let me go back. So I see where it says, this is all the plans that are available in the zip code that I put up.
Right.
So right here, you can see the monthly premium. See the big, you see that?
Yeah.
So if I scroll down, it's going to start showing ones that have premium.
Oh, okay. Okay. I haven't gone in here yet. So.
Okay. So if you need help, let me know. I'll walk you through it. We could do a separate Zoom.
Okay.
But you can see here, it shows the premium, and then you go into the plan and check it. So for example, there was another area in California. They don't have very good Medicare Advantage plans there. I think it was up north, but this person was on the $99 a month Humana plan, gold plus. Well, it's actually the best plan for his situation, because the doctor's group, that's one of the only plans that they take that he's at, and he wants to stay with that doctor's group. So I did this. I went to Medicare Center, looked up all the plans, and I started looking at all the plans. I put the doctors in there, and it automatically brought up, it shows you the top plans at the top. So in other words, if there's only a couple plans that cover those doctors, they're going to be the first couple options. So what happened was, I looked at all the zero premium plans, but a lot of them didn't cover that group. And if they did, it just didn't work. So that $99 a month Humana plan is the one that he's going to stay with, because all the other plans weren't covering those doctors, or weren't, he would have had to pay a lot more. So there was a lot of plans that were around $50 a month. So not 99, but $50 a month. But the plans weren't as good as that Humana plan. He would have paid a lot higher copays for medical, for, all the stuff that he was doing. So I'm just giving you one example, that this is someone I just talked to 2 days ago. So the zero premium didn't work for that guy, even though I thought it would, so I went through all the zero premium plans, and none of them worked. And it was that $99 plan that he's going to stay with, because the zeros didn't work. But I'll be talking to him AEP, so he's on my list. So, but all of you have access to this Medicare Center, and it's awesome. I mean, you have all this stuff quick at your fingertips to find a plan for someone. It's real fast, real quick, especially when you put all the parameters in, like all their meds, the pharmacy, the doctors, and it's doing the work for you. Then you just have to check between 2 or 3 plans, possibly. You know, sometimes it narrows it down to one that's by far the best for them. All right.
Great, thank you so much.
Yep, no problem.